my name is Michelle Jones, and I'm the city's epidemiologist, and I'm here at the City of Brownsville Public Health Department, Maternal Child Health Division. And we're here to address a little bit of the hesitation and fears we might have surrounding COVID-19 among our pregnant women and our breastfeeding women. So there are individuals that are hesitant about getting the vaccine because we just don't know. And we completely understand that. A lot of the information is contradictory and we're just uncertain. One thing we do want to discuss is that COVID-19 does have negative health outcomes for pregnant women. So if you get COVID-19 while you're pregnant, you're at a higher risk of being hospitalized, being put in ICU, being put on a ventilator, blood clots occur, and the general outcome is just not that positive for pregnant women. So the City of Brownsville Public Health Department, we highly encourage everyone to go ahead and get that vaccine. The Pfizer, Moderna are shown to be excellent combatants against the virus. You get a substantially lower risk of getting the disease, but in addition, hospitalization, ventilation, ICU, preterm births are drastically reduced. And the studies that have been conducted are showing that the adverse effects, which more or less what we're talking about are side effects, how bad do we feel? They're not any worse for a pregnant woman than they are for the standard population. So just bear that in mind. In addition, and this is really, really exciting news, if you get the vaccine while you're pregnant, studies have shown that antibodies are in the baby, in the umbilical cord, and also is passed through your breast milk to the baby if you are breastfeeding. And what does that mean? What is an antibody? Why do I care? Well, the important thing about it is that you are transferring your immunity to that child. So if they're in the hospital or you've got a loved one that's holding that baby, their immune system is ready to start fighting that from the time they are born if you're vaccinated. And that immunity is also passed on, like I mentioned, through the breast milk. So let's say due to conditions beyond our control, you have to wait a little bit for that vaccine. Go ahead and get that as soon as possible. And when you're breastfeeding your baby, those antibodies are being transferred to that baby so that way they can fight off COVID infection if they come in contact with that. And in order to help out finding the vaccines, you can always go to our website, btxcares.com. And always remember, talk to your OBGYN or your primary care physician. They'll be able to put you in contact with the resources that you need. Thank you so much.